In the dental implant field, I think the material, especially the titanium, the grade of titanium and the type of titanium that's used, that playing field has been sort of leveled. You know, all the bigger companies that we see out in the market are using similar type of type 4, type 5, or mixture of titanium. So to me, that's less of a concern in terms of the quality of the material. But as a patient, I would like to know, what kind of company, what kind of brands are you using as a dental implant? Is this something that is commonly used? And if so, what type of restorative materials will be going into my mouth? So I think what's important from a patient perspective is that there's two main components to implant dentistry. There is a surgical component, which deals with the dental implant and the titanium, like the type of titanium and the material, as well as the brand. But when that implant's osseointegrated into your jawbone, your provider or your general dentist, restorative doctor, will be fabricating the abutment and the crown that goes on top of the implant. The restorative component, which is the second half of that implant journey, I think is also as important as the surgical component. So as a patient, I think it's important to know what type of material they're being used to fabricate the abutment and the crown that goes on top of my implant, whether the crown will be cemented on versus screwed in. And I think those are all important questions that you should know and have an understanding of. And rather than, there's so much focus on how many implants have you done, how many are you placing? But I think, what's more important in my opinion is for the provider to be able to have enough experience in various procedures so that they can deliver the most predictable dental implant.